Hello, everybody, and welcome to the Food is Health Revolution podcast, where we cover food is health solutions from soil to cell. I am joined by my friends Ellen Brown from BP2 Health and Carter Williams from I Select Fund. Welcome, you guys. It's Friday.
Yeah,
It
good
is
to see you all.
Friday.
Excellent. And today we're going to have such an exciting deep dive with a legend in the field, Dr. Joseph Pizzorno. We're going to be talking about functional medicine, toxin exposure pathways, lots of the pieces of this healthcare puzzle that I think we don't focus enough on. So we're really lucky today to have Dr. Joe, as we know him on our shorthand chats, joining us. And I said earlier, I fanned out because I have his book on my shelf already, and it's so cool to meet the author of a book that I've read and loved. And so this is a really great podcast for me today. So welcome, you guys. We'll start as we always do with things that we learned this week. And as we're trying to be clear about the foundational tools we're starting to learn to build a toolkit for food as health, really interested in some of those pieces. What are some shiny objects, tools, important pieces of the puzzle that you guys picked up this week? Carter, I'll start with you.
Yeah, so I did a post a bit on this on LinkedIn, and that is in economics we talk about total factor productivity, and like if you use Google search, it makes your life easier. It doesn't really create economic output, but it does, and that's sort of total factor productivity is what you do to create economic output in that regard. So I put a post up a little bit around like we should be thinking about productivity of nutrition, like the factors of nutrition that affect our daily life but are not accounted for in any real like immediate measure, right? Happiness, I'm able to work better, and that there are all these other factors. And as we think about optimizing nutrition or price or health, that if you start to really think about, hey, I'm optimizing the productivity of nutrition delivery, you can then start sort of wandering that into, if I align food to increase nutrition, if I align healthcare to optimize to nutrition, and if we do those things, you get positive externalities. People are healthier, people are happier, people can work more effectively. The positive externality of better nutrition is better soil, that's better environment. And all of a sudden, all those things start lining up. And when they start lining up, they start adding up, and you start getting exponential benefit.
Yeah, the multiplier effects start going, Carter, for sure. You know, for me, that lines up with something I spoke about to a group at Tufts last week, which was about, and I think I may have talked about this before, but we have quarterly jobs reports in this country. And I would love every quarterly jobs report. This is where I'm adding to a tool I'd love to see in the toolkit. I'd love to see every quarterly jobs report for this country paired with a quarterly workforce health report. And I'd love to see us say, great, we just created 400,000 new jobs. Have we just made 400,000 people healthier and prepared to go fill these jobs? Because we're watching a presidential election right now, and what's getting talked about constantly? Jobs, jobs, jobs. You can add all the jobs you want, but Carter, if the things in the flywheel aren't going that you talked about, we can create all the jobs we want, but we're not going to be able to fill them with people who aren't healthy enough to show up. And I think we have to start building the toolkit around how do the things you talked about, they have that externalities, but they have an economic value to them in our society that I think we need to start making part of the mainstream conversation.
Sort of like we reported COVID, we do not report on the type 2 diabetes pandemic and anything close to the way we did on COVID.
Right,
and
exactly.
Pandemic, more people are dying. I'm pretty sure this is true. I think more people are died through type 2 diabetes on a daily basis than I think at the peak of COVID in the U.S. I may be wrong.
They did. No, they did. You're absolutely right. At the hearing I was at yesterday, that Dari reported, he reported out on that statistic that more people died with diabetes in a very short period of time than the entire COVID pandemic.
Yeah, and Ellen, just so our listeners know, when you're talking about Dari, you're talking about Dariush Mazafarian, who's a colleague of mine at Tufts University, who runs the Food as Medicine Institute, newly launched at Tufts. Yeah.
Yep. Absolutely.
Yeah, and
So,
another aspect to the diabetes story is now diabetes accounts for 1 out of 4 healthcare dollars. 20 years ago, it was 1 out of 6. So it's the
wow.
Yeah.
it's the most expensive
Well,
disease.
and to add to that, I mean, a lot of people don't understand. I mean, only 7% of the population is healthy cardiometabolically. So, like,
Which is
that's
outstanding. Which, by the way, when I get back my tests and it says that I'm a 53-year-old woman and my function health results said I'm a 37-year-old, I was like, wow, I'm actually in a statistical minority. I'm pretty
you really
psyched.
are. Like you're really in a statistical minority. I
Yeah,
mean,
I'm excited.
Well,
Um,
Ellen, what else did you learn at the
yeah,
on the hill? You were on the hill. What were you doing on the hill? When
yeah.
you
Tell
yeah.
us about being on the hill. What'd you learn?
well, I haven't been on the hill in like 15, 20 years. So it was like, wow, I'm back on the hill. um, I was there, I guess, a lot more to listen and observe.
What was the event,
And
Ellen?
so I went to the National Produce Prescription Collaboratives day. You know, they did a big day on Wednesday, and then we had an actual Hill Action Day on Thursday that they set up with all sorts of representatives, right, on both sides. And so I went with Aaron Martin, Fresh RX Oklahoma, and
A
really went
previous guest
under
on the
the
show. Yep.
and went under the guise of really just an organization that I think what's really important and what I tried to point out when we talk to people to your question, Carter, was there's a difference between nutritionally dense food and just food, and that the program that Erin's putting together it's actually addressing some of what you guys are talking about just now with productivity, which is she's actually bringing jobs back into the farm industry with specialty crops that have historically not supported that. So there's growth in actual supply or demand, right? And then the supply that's needed in order to heal people with nutritionally dense, regeneratively grown produce. And I guess that ties into the other part of my learning, which was we've really, and I'm really sorry, I'm not going to be very popular, but we've really kind of made a mess of this food as medicine scene. And we have really confused it with food insecurity. When we talk about food as medicine, this group in our podcast, we focus a lot on metabolic, cardiometabolic syndrome, metabolic health. We even get into the toxicity piece, cancer, a lot of the underlying conditions, and a lot of the drivers that end up causing cardiometabolic syndrome that come from the toxicity of the foods that we eat, which I know we're going to talk about today.
Yeah.
But what I saw was there's no discussion around outcomes. I sat through an entire day of food as medicine programs, and Erin was the only person out of probably 50, I'm not exaggerating, that actually shared an outcome with health.
No.
And it really struck me. And then what it struck me is imagine I'm a politician and I'm hearing this. All I'm hearing is I want money. I want more money. I want more money. All the money is being spent on our healthcare and in our food system. There are trillions and trillions of dollars. And we really do need to figure out a way to redistribute some of that and not just ask the government for more.
I
It
wonder,
just,
Ellen,
so
do we need to find a way to quantify the value of being well?
we do, but I will tell you that has been a conversation, at least on the healthcare side, for decades. And the challenge is it goes back to that insurance. I know I drive people crazy with this, but I buy homeowners insurance. I'm still responsible for maintaining my roof. I'm still responsible for fixing the soffits, for making sure that the siding's not falling down, right? My homeowners insurance only pays when there's a catastrophic issue. And our health insurance system is truly sick care delivery. It's not truly insurance anymore, right? We've confused that. So I'm not trying to complicate it. I guess my point is, like, I don't want to keep talking about problems. I know that's something we want to, on this podcast, we want to focus on solutions. And my takeaway in that was we need to do a better job when we're communicating with anybody about food as medicine as to the outcomes, the savings that we achieve from actual healthcare dollars spent today, not just healthcare dollars avoided. But when we
Yeah.
talk about that, we should talk about, okay, the Medicare Trust Fund is going to go bankrupt within a very short period of time. If we reversed lifestyle disease in 5% of people over the age of 65, how much longer would that extend the Medicare Trust Fund? That is how we need to be speaking
Mm.
about this, instead of we need more money to fix the system because it's broken.
Has anyone done, if someone were to do that calculation, or some
Yep, we could
uh,
do that.
Elway Bandit firm did that, who would do that? Who would?
We could have an actual firm, the actual firm that right now is running for Erin, the savings that her program is yielding, like she's doing this whole analysis, I could have Colby do that in, a couple of weeks. And
If
I've thought about
and,
actually having him do it. I think it's important.
yeah, and if we wanted to real time report on a daily basis the
Mhm.
number of people who've been newly diagnosed pre-diabetic, or newly diagnosed type 2D, and newly diagnosed off, and newly
Mhm.
diagnosed off. Is that like who could? Is that like an
Well,
agreement from all the EHR folks to roll that up, or?
that is going to be, I know a firm that right now is scraping all of the EHR data, but the challenge there, Carter, is that the ambulatory, which is the outpatient, all the physician EHR data that you're
Yeah.
talking about, there are 900 EHRs, and only
Hmm.
only about 40% of them participate with organizations that scrape that data commonly to be able to pull it. So you actually go to each one of those EHRs,
Wow.
and there are a couple of organizations. I don't think it's impossible at all, Carter. It's just that there isn't a registry readily available like you're talking about. However, you could simulate with the statistics that we know and say, if we
Yeah.
continue on the trajectory that we're on, right, this is the cost. And if we just reduced it this much, this would be the amount. But I do think that it's imperative that we do have a better handle on what's actually happening real time with the health of our population, and not in some 5-year retroactive study, or it takes 5 years to come out.
Well, and I know it's not popular in this country, but there are other countries whose EHRs are rolled up nationally so that they have
Correct.
national level data on everybody, because your health record is
Correct.
interoperable
Correct.
and is part of population
Correct.
health. And it's how the country proactively puts policies in place to support the health of its country.
Yep.
Um,
Well, I'll give you a quick example, and then I know we would definitely want to hear from Dr. Joe.
we got about 3.5 minutes to talk about what we learned.
Okay.
Go ahead.
Well, let me just say this one thing on what you just talked about is, I'll give you an example, Carter, practically what I'm speaking about is that, like, Epic, for example, is a dominant force in the inpatient acute care space, right? Like and so if you want acute care, you can go to Cerner and you can go to Epic, and you get a vast majority of the data, right? On the ambulatory side, you can go to Epic and Athena, and again, you can get a chunk of it, right? But I'll give you an example. I tried a tool that's in development right now that you put your information in, and then it pulls all of your EHR data in, and then it combines that with all of your wearable data, and it gives you basically it gives you a FICO score for your health, right? Very cool. So I got super excited. I was like, okay, I'm going to try this out. And it was missing 50% of my data because I happen to go to doctors, and I'm not talking about concierge doctors, but I happen to go to doctors that are not part of health systems.
Right.
And so therefore they're using much smaller, if they are even using an EHR, much smaller EHRs. And so for a company like that to pull that data, they have to go to each one of them. So that is a practical example of what we're talking about here.
Yeah.
Yeah, 100%. Plus, if you're going and purchasing functional medicine doctor time like I do, that's never going to be recorded anywhere.
Yep. The other piece to this that I'll say, you guys are talking about productivity and things like that, and I think the other piece that really struck me, because last week, I was out in Colorado at the Think Regeneration event, and then spent the day with a celebrity chef, and then Carter, you made a point this week that I jumped on, which was, could we use social media, the virality of a social star, for example, to really spread the word about food is health, right? Like, and we were talking about Taylor Swift in your post. And so what was really cool last week was Erin and I spent the day, not the day, but a couple hours with who's considered a celebrity chef. And he happens to have, Michelin star rated restaurants, James Beard Awards. He's part of a growing network of what we call impact chefs. And so what we've talked about is not just focusing on regenerative farming practices, because that's what he really focuses on, having a closed loop kitchen, having a closed loop system of the food that's coming in, to know that they're nutritionally dense, they're not chemically laden, right? I think that's a huge opportunity for the country, is if you start exposing people in that way. And we challenged him to say, can we add to that impact designation and actually make it, there also have like a food as medicine impact, as it's not like there's some formal designation, right? But this idea of, can you guys add the food as medicine component to this? Because if people are like, oh, the chef is amazing, and I know I'm not getting at the virality of kids, because I think that's we can have a whole podcast on that, of how do you go after the teens and the tweens and the younger kids that are all consuming. I mean, my kid sits on TikToks for hours, right?
Hey, I can do a podcast on that, just on my own 2 teenagers.
But I think that's a huge key when we talk about kids. That's another learning I had, is we really do have to figure out how to that is, when we talk about a tobacco campaign and kind of like a new version of that, we're going to have to get a star like a Taylor Swift. Maybe she'll hear this podcast, you guys, and Taylor Swift will be like, yes, I'm in. So.
Yeah.
I have to admit, I don't think I've ever heard a Taylor Swift song.
Oh,
I did invoke her name, and I think that it would be more productive if she commented on health and politics.
Somewhere where you were standing in line waiting at some store, there was a Taylor Swift song in the background. I guarantee you. I
think using their social credit to push an issue rather than getting mucked up in the other insanity that's going on.
I actually think there is a real in here, Carter, with her, because of what her boyfriend signed on with his brother. I'm not kidding. Like, I actually think it would be her. We need to figure out how to get to her publicist, because I think she is the kind of person that would really go, wait a minute, I didn't realize how much my man stepped in it, and I'm going to undo it by getting behind something healthy. Because she is a very healthy, she is a really,
she's a foodie. But we have a podcast. Jason and Travis have a podcast. Maybe we just need to somehow instigate their podcast.
We do. Okay. Sorry.
All right.
Katie.
We're at 17 minutes. So we've taken 2 minutes of Dr. Joe's time. So let's just dive into our speaker here. So our guest today is Dr. Joe Pizzorno. Dr. Joe, do you pronounce it Pizzorno or Pizzorno? Because my maiden name is Galuzzo, which a lot of people who are Italian say Galuzzo, like pizza. Right? Pizzorno.
Yeah, you nailed it.
Nice. All right, we got it. So
we're Americanized Pizzorno.
That's right. So Joe is a pioneer, like full stop, pioneer with a capital P in the natural and integrative medicine space. He is the founding president of Bastyr University. He's the author of so many amazing books. The Toxins Solution, which is on my own personal bookcase and I just love. And he's a mentor to such famous functional medicine leaders that we know, like Dr. Mark Hyman. And so, Dr. Joe, we're so happy to have you with us today. I was saying earlier at the start, I've spent the early part of my career and a big chunk of my career as an environmental planner in a low-income community that had a deep, deep industrial background, Springfield and Holyoke, Massachusetts. There was a time when in that part of Massachusetts, we invented and made so many things. Rolls-Royces, invented the monkey wrench. We had, the list goes, we invented more than just basketball. It was lots of the industrial revolution happened in places like Springfield. And the legacy of that, not to mention all of the new arrivals who came to town from other countries. A leading entry point into the economy is auto body and automotive repair. And what I think listeners may not know is when you have illegal automotive shops that don't follow the norms and standards of proper disposal, you also have a lot of machine oils and toxins and solvents being dumped down drains. You have solvents going into the air and landing, for instance, on snow in Massachusetts that's then breathed in by kids who have chronic asthma. We would have bus idling depots next to schools. We had schools growing with black mold. The list, I ran a program training people how to do fish tissue sampling in 13 lakes and ponds. Those samples show that we had high levels of PCB contamination in the fish that people were eating as a primary source of protein. And so, the list goes on and on and on of all of the toxic exposure pathways that were happening in this neighborhood. So I'm so excited to have you on today. And I just want you to just open up and give the readers a sense. People might be joining because they're very engaged on the healthcare side, very engaged on the farming side of what we do. Talk about why we should all understand the toxic pathways into our bodies and why that matters in this conversation.
So
thank you.
So Joe, I'm handing it to you too, but I just have to tee up that at some point you have to let me, Katie and Joe, you have to let me give the example of my daughter, because it is the perfect example of why this makes so much sense from a financial, perspective medically.
I promise
at the
I
end.
will,
So
Ellen.
there you go.
Great.
I will. Take it away, Dr. Joe.
Well, I think you'd asked the key question. So, I've been involved in medicine now for literally over half a century. I started in conventional medicine, and I learned about natural medicine. I just got totally engaged and interested in it. But when you look at the diseases I was seeing 50 years ago compared to what we're seeing now, it's changed dramatically. 50 years ago, I was looking at people having problems with nutritional deficiencies and nutritional excesses and lifestyle problems, things of this nature, and fairly straightforward. But over the last 50 years, we have systematically and consistently increased the amount of toxins in the environment. These are metals and chemicals, and many of them are new to nature molecules and heavy metals that we didn't get exposed to as evolved as a species. And so what's happening is the nutritional deficiencies didn't go away. They actually got worse. I've got hard data on that. What we've done is we've added to it now all these environmental toxins. So you think about, well, why do environmental toxins cause trouble? You have to think about, well, how do our bodies work? Our bodies are enzyme machines. Everything happens in our body depends upon an enzyme. Enzyme converts food into energy and food into proteins for muscle building, all these things it does. So how well those enzymes work determine our level of health and our susceptibility to disease. And even when a person has a disease, it's almost always due to the enzyme not working properly. So many diseases, we just get the enzymes working properly, the disease is reversed. Okay, so going back to this enzyme. The enzyme is composed of two parts. Number one is what's called an apoenzyme, or more easily said, it's protein. So it's a protein that's determined by our genetics. Okay, so while we might say we all have pretty much, human beings have a lot of, like 99% of our genetics is exactly the same. But that 1% that's different hugely impacts our physiology. Okay, so we make these enzyme cores, these proteins, and some are made really well. Some of us have genetics where we don't make them real well. But it doesn't do anything until it has a cofactor. The cofactor is the vitamin or mineral, almost always. Okay, so the enzyme doesn't work if it's not made properly. It also doesn't work if the vitamin or mineral necessary for it to work is not there. Okay, so right there we got a big problem because we have all these deficiencies. So for example, I did a corporate wellness program in Canada with 4,500 oil field workers. And I had this sponsor who was really dedicated to the health of his employees. And so when he flew me from Seattle up to Calgary in his personal Learjet and said, help improve the health of my employees, I said, well, I'm a true believer in natural medicine, but I'm also very objective. So I want to actually measure the level of nutrients in your population, measure the level of toxins, measure how well they're functioning. So when I looked at the nutritional data that came back, of the 4,500 people, only 50 of them were not deficient in at least one nutrient.
Wow.
Okay, so 4,450 of them were deficient in at least one nutrient. And when you look at half of them were deficient in many, many nutrients. So right there we have.
In that large population of them, there were enzymes that weren't working as they were supposed to.
Enzymes weren't working. So of course they're getting disease that it was preventable and in many cases reversible. Okay, so now we got this huge problem with environmental toxins. And I'm sorry, with nutritional deficiencies, largely because of our foods are not being grown with as much nutrients, but people making a lot of dietary choices which are not particularly healthy. Problem is, we now add another problem, and that is these metals and chemicals in the environment. So then one of the things I did is I looked at, well, how about toxic measures? I found all this toxicity as well. So now why are the toxins a problem? Go back to those enzymes. So when a person is exposed to a toxin, what many of these toxins do is they displace the vitamin from the enzyme, so it can't work, and they basically poison the enzyme.
Wow.
So not only are we making our bodies more susceptible to dysfunction because of the lack of nutrients, some foods are putting more toxins into the food as they're removing the nutrients from the food. So it's a double whammy.
Wow.
And just to go back a little bit, even in that analysis, how do you know whether people are nutrient deficient? Is that reported data or blood data? And then how do you know whether the toxins are present? Is that?
Okay, so two really good questions.
Or
So it turns out it's more difficult than we would like it to be. So for nutrition, there's some nutrients where you just look at the level of the nutrients in the blood and you'll know whether they're okay or not. But in many situations, you have to recognize that we are biochemically unique, and that while there may be enough of a nutrient according to an RDA, well, according to that person's neat genetics, and they may need a lot more of that nutrient. So in that situation, you look at, well, what builds up in the body are the measures that build up in the body that happen when a person is deficient in terms of the amount of nutrient they need. And there's there's a lot of good research on it. The one I like looking at is homocysteine. I assume everybody on this podcast knows what homocysteine is. It's a toxic. So first off, homocysteine is a normal molecule in the body. The problem is you don't want to get too high. So when the homocysteine gets too high, you get more cardiovascular disease, more Alzheimer's, more cancer, and it's really bad for us. So in order for our body to metabolize homocysteine properly, we need certain nutrients, vitamin B6, vitamin B12, and folate. Notice I didn't say folic acid, I said folate.
Folate.
I don't know if we want to get into that or not. Okay, so there's a number of studies have been done now, so I know this is valid when multiple studies show the same thing. So the first thing they did is they looked at the blood levels of B6, folate, and B12. And they determined that if you look at the general population, only 6% of people over the age of 60 are deficient in one or more of those nutrients, according to blood levels. But then you look at what builds up in the body, like homocysteine, methylmalonic acid, okay? How much of those are elevated because the body does not have enough of those B vitamins? 63%. So 2/3 of our population has nutrient deficiencies right there because their own biochemical needs indicate they need more of it because of how their enzymes being made.
is that a function of the general diet and the shift in the general diet, or I mean, why are we can we make a bulk suggestion? Like we often in diabetes say, stop eating processed sugar. It's like a bulk decision that in many ways helps a whole bunch of people shift to a slightly better plane. Is that true in terms of like environmental toxins or some of these missing elements where we can make a big bulk suggestion?
Yeah. So there's two factors going on here. So we're going to assume there's a lack of number of nutrients according to the RDAs. And by the way, I don't think the RDAs are very good at all.
Well, that's what I was going to follow up with. Like, how old are the RDAs, and is this part of the problem? Because RDAs are for everybody. There aren't like differentiated RDAs. Like, I don't go to the doctor, and the doctor's like, "Here's your set of RDAs." Like, that's what we really need to get to, right?
Yeah. So first of all, remember the RDAs were defined as what's necessary for 95% of the population when they're healthy to not get sick.
Right. When they're healthy, that's the important. When they're healthy, which 2/3 of the population is not.
Not healthy. Okay. So going back to your question, Carter. So the problem with their having elevated metabolites in the body because why is it happening? Okay. So it could be because they need more B vitamins according to unique biochemistry, or it could be that they're being exposed to environmental toxin that's poisoning the enzymes that are supposed to break down the homocysteine.
Okay. So how do you figure that out? Like if because whenever we have these kind of conversations, people are like, I want to pay more attention to that. I wonder if I should run this test. I wonder if I should eat that, which goes down this rabbit hole that God knows where it ends up. But like clinically, we're thinking through it.
Let me tell you,
how should people think through it?
Okay, so here's our big challenge. One of the worst neurotoxins is mercury. And the only way to determine how much mercury is in the brain is put a needle into a person's head and pull out some brain matter and see how much mercury is in it.
Oh,
in general, patients don't.
Have you done that yet?
Patients always say no. Okay.
If so one person would say yes, it would be Ellen.
It would. Ellen would be like, I'm up for it. Stick it in my ear.
Anyway,
let's make sure we send her a link for where she can sign up for that.
Needle in the brain, mercurytesting.com.
Dave and Justin are absolutely going to love the comment you just made, Carter. I'm just going to tell you that right now. They're going to be like, yes, he has her coined.
But I thought, Dr. Joe, you could test for mercury poisoning.
Let me continue.
Okay.
So now our preference is directly measure the tissues. Actually go to the cells, see what's in them. We can't do that in almost every situation. The next best is what's in the blood. Now, the blood tends to be a little challenging as a diagnostic medium for various things, but that's our best choice. And the final choice is urine. Now, the advantage of urine is easy to collect, easy to ship, can be stable, and it does a good job. But it only tells us what the body's getting rid of. So you might have somebody with a low-level toxin in the urine, but you look in their blood or you look in their sweat, and they're full of toxin.
Okay, wait. I'm going to actually jump in here for a second for those that are following this, kind of your point, Carter, about like people go, oh my goodness, this is super important. So what you just said is it's what somebody is getting rid of. And when people are in toxic overload, right, there is a big chunk of them that actually can't get rid of anything because they're in such overload and their systems have actually shut down to detox properly, aka pooping right, sweating right. Think about people that are super sick. Like those systems start to shut down hormonally even. And what happens is you test people for that, right? And it's non-detectable. So like, for example, my daughter had she wasn't showing anything with mold because she was excreting nothing. After we got her pathways working again, she showed a huge toxic load. But I think that's super important for people to understand is like, when you're testing for this stuff, it's not just cut as dry as doing a test and it's yes or no.
Thank you. Extremely well said. If you read my book, Toxin Solution, one of the very first things I say to people, oh, well, thank you. So one of the first things you say to people, one of the worst things you can do to your body is to go on a detox program before your body's ready to detoxify.
Yes,
so that's why in the book I say.
My daughter lived that dream. So
okay, yeah. And I've seen patients like this. The person says, I was doing fine, but I read this book on detoxification. I did detoxification. They come see me because they're really sick. And there's plenty of research on this. So the idea is if you're going to put a person on a detox program, I say first, I just stop the toxins. I mean, so many people don't realize how everyday living is filled with toxins. Okay, so you got to stop the toxins. Then now we got to clean up the gut because the biggest load on the liver of toxins comes from having the wrong bacteria in the gut. Now you got to clean up the gut, get the right bacteria in there, make sure your mucosa is stable so you're not leaking your gut products into the body that aren't supposed to be leaked, get the gut working properly. Then we get the liver working properly. Okay, and there are lots of good things we do there. And now in this book, but the book I wrote, it's 30 years ago now, called the Total Wellness. In that book, I was talking about how you get the systems of the body improving. I didn't say anything about the kidneys when I wrote the book. I wasn't seeing kidneys problems. Now I'm seeing all these kidney problems. So I had to add another chapter to the book on how do you get the kidneys functioning properly.
Wow.
And it turns out we're having a kidney failure epidemic. Wow. Why are we having a kidney failure epidemic? Because of all the environmental toxins we're exposed to and the overload of prescription drugs. I'm not saying prescription drugs are wrong, or prescription and over the counter, but the non-steroidal anti-inflammatory drugs, and I'm going to include acetaminophen in this, Tylenol, even though it's not strictly an NSAID, but those things are all really hard on the kidneys. So it turns out a lot of the damage is coming from the drugs that people are getting because they're so sick.
And so, and one of my questions on that is, so we've got a person that we work with who talks about the massive increase in NASH, non-alcohol fatty liver disease, right? Even in kids.
Yes.
Are these tandem diseases, kidney disease and NASH? Would you see them coming together at the same time? Is my first question. And my second question is,
wait. Can we do one question?
Okay, go ahead. Yeah.
Okay. So we are seeing so many diseases that we've never seen before. Non-alcoholic fatty liver disease did not exist 50 years ago.
Really?
Yeah. So what's happened? We've started eating huge amounts of high fructose corn syrup.
Yes.
And we're putting things like phthalates and bisphenols into our food supply, and those things directly correlate with fatty liver disease.
Wow.
I mean, we're just basically, what we're putting in our mouths is what's causing the disease.
And Dr. Jill, I was also told once that when you drink alcohol, that your liver will prioritize detoxing the alcohol before it does anything else. And so you're adding drinking onto it. How does the consumption of alcohol tie into this, or is that an overstatement?
So I think it's good when people kind of have conversations like that. But alcohol is actually pretty interesting. This is a chemical our bodies are really good at detoxifying. Half-life of alcohol is like an hour. Okay. Whereas all these other environmental toxins we're exposed to, they have much, much longer half-lives. So while they say it's going to detoxify alcohol first, that's true. It's going to detoxify alcohol first because it's really good at it.
Right. But if you're already like super, super taxed and your body's not working well, and now it's like, we're going to go focus on detoxing alcohol, that's still a whole waiting line of other stuff, right?
So here's where the problem is, in my perspective. The detoxification of alcohol depletes glutathione. So every molecule we detoxify in the liver produces one molecule free radical. When the body's working properly, that one molecule free radical is immediately quenched by glutathione. But what happens if you consume a lot of alcohol? You're now depleting your glutathione stores. Now we expose the other toxins, you're less able to detoxify them, but more importantly, your liver is more damaged in the process of detoxifying them.
Right.
So that's where alcohol makes everything worse.
Wow. Okay. Yeah.
As we in a broad scale, we talk about food as health, and then in a broad scale, we often say, get rid of sugar, and then pretty quickly, processed sugar in particular, and then pretty quickly we say, get more fiber, as sort of the two first, and then we say to agriculture and processors and food people, figure out how to re-engineer what you're doing so that there's less sugar in the system, so that it's easier when someone goes to the grocery store that they make a good decision. So that's sort of the conversation we generally have. As you think about the toxins, is there a shift in that priority or in addition to that priority? It's like as people think about, we're going to re-engineer our food system to make it better, and you take your experience with toxins, what's like the agenda that people in agriculture and CPGs, and what should they be thinking about in the products that they're trying to develop?
And Carter, I just want to add one layer onto that, which is, if you go to the grocery store, I always say I can get 2 cans of black beans. One is a can of black beans that has just black beans in it, and it's really nothing else, like an Amy's product. And then there's a can of black beans that has like 25 different ingredients in it. And the 25 ingredient one's like 75 cents. And the low ingredient one, the minimal ingredient one, is like $3. So we have to pay a premium to not eat chemicals.
Well, and the other layer I wanted to add, Carter, to what you said is, when I talk to folks about food as medicine, food as health, I always talk about the reduction of chemical load in the food that we're feeding people, that's an imperative component to this, not just the nutritional density. So like when we talk about the importance of having regenerative farming as the way that we're reducing it, like we can't try to heal people with foods that are grown with tremendous chemical loads, because that's leading to the high cancer rates. Like when we look at what's what's costing the healthcare burden, right? It's not just cardiometabolic. The other condition that's at the top of the list is cancer.
We do, but you guys and Dr. Joe, we still need shelf-stable food.
Yeah,
agreed. But you hear what I'm saying, Katie? Like whether you're dousing, I guess I just wanted to add to Carter's point. Like when I speak to it, I do talk about produce that's grown without huge chemical burdens, because that is something that has become standard fare, just to try to grow it quickly and to try and keep the bugs off and get it out the door.
Yeah. So Dr. Joe, how do you think about that in terms of the food?
Okay. So first off, let me go back to Carter's question, okay? Because that one, it illustrates the whole problem so very, very well. So about 10 years ago, I became aware of the diabetes epidemic. And I started looking for, why is it happening? And the first thing I did, I looked at sugar. And indeed, we consume way too much sugar. But I couldn't find a correlation between sugar consumption and diabetes. I was so surprised. Now, let me be real clear. I'm not saying eating sugar is good for you. But in terms of the diabetes epidemic, it didn't explain it. Maybe a few percent of it didn't explain it. So I started looking further. I started looking at, wait a minute. How about these metals and chemicals in the environment that researchers are calling diabetogens? If you want to get into this more deeply, look at the work of Ducky Lee in South Korea. She's the one who about 15 years ago started showing the correlation between environmental toxins and diabetes. And she published a study, it's almost 10 years ago now, that really grabbed my attention and led me to write an editorial published 8 years ago, where I showed that about 90% of the diabetes epidemic appears to be due to environmental diabetogens. So these are things like phthalates and bisphenols that bind to insulin receptor sites so that they become insulin resistant. We all hear about this. Everybody's got insulin resistance. Well, yeah, they may be eating too much sugar. They may not be exercising, but guess what? Maybe the chemicals covering it up. Okay, so that's pretty interesting. Then you look at things like arsenic. Arsenic poisons the ability of the pancreas to produce insulin. You might say, well, arsenic, that's not that big a problem. 1/3 of Americans have arsenic levels into the range that's known to increase disease risk.
Wow.
Okay, so look at something like diabetes, which when I started primary care way back in 1975. Okay, and it took me a year to see my first diabetic patient. Well, you might say, well, young practitioner, of course you're not going to see many patients for a while. Okay, I'm good. I was booked. I was 100% booked in 6 months after I opened my doors. Okay, because I was helping people. So I was so excited when I saw a diabetic patient. Now they're everywhere because we've poisoned the environment.
Yeah. That's
so how does that, if we take those, I'm not going to be able to even say it, diabetogens.
Mm-hmm. Diabetogens, yes.
Where are they coming from? Are they coming from the food? Are they coming from natural water? Are they coming from non-natural?
Food, water, and food containers. So I actually just wrote an editorial on safety of plastic food containers. And I just also wrote one on microplastics. And it turns out that what we're putting our food in is a huge contributor to the toxic load. And people worry about microplastics. I'm going to tell you right now, you want to drop your microplastic load the most, never ever drink from a plastic water bottle.
Yeah, I've stopped doing that. I also think, Dr. Joe, we can't discount health and beauty industry and all the things, that we put on our skin, which get absorbed into our blood. I think about all the lipstick, makeup, all the stuff that I've put on my body. And then I also think about all the cleaning supplies that people are exposed to that are highly toxic, especially in combination. I think about the carpeting that my parents always had in the house and got excited when it was new and threw a new baby on top of it.
New carpet smell.
That's right. New carpet smell. It's amazing all the places that it comes from that sometimes we can and sometimes we can't control. There's a lot of situations where we can't control it, especially when we're in situations where we are lower income and you're in places where there's probably way more environmental hazards around. And by the way, this is where social determinants of health and this space intersects. I used to say I would love to put on someone's medical record that they live next door to a contaminated site, because shouldn't the doctor know that there is a contaminating land use next door to this person's house that could explain the rashes, the asthma, the diabetes? Dr. Chris Olson at the Food Allergy Science Initiative, which is at the Broad, she also would have a lot to say on this as well. Dr. Joe, she also agrees with you.
I want to dig in a little bit. Like, okay, what tests do I order at Quest? Is this an open loop problem, like solve all these other problems, or I can go, like, if I know someone who's got diabetes or even pre-diabetes, should they run a panel at Quest? Is there a separate, to sort of understand whether they're consuming the diabetogens?
Diabetogens.
Right. Where is
how are
the diagnostics handling this? Yeah.
So the good news is that Quest, the big boys, they are starting to offer more tests on environmental medicine. So there are some tests that are available there. They're not very broad choices, but they do have choices. That's good. But for those who want to get the proper sampling and testing, you need to go to a lab that's been doing toxin testing for a long time. So 2 labs I recommend are Doctor's Data for metals, and then Mosaic Diagnostics for chemicals. And by the way, in the past, I've been a paid advisor to Mosaic, so I advise them on what test to run. I'm not.
So if we to sell them here, what is that process? You
take a urine sample.
How do I run that test?
So first off, you need to go to the website and or find a doctor that'll do this with you to find the proper collection procedures for the test. Because you can't collect these things in any old container because those containers are contaminated. You want to know what's in your body, not what's in the contaminated container. So you have to get the right test. And that's just a urine sample you send in. But again, it's a urine sample, so it's only tell us what your body's getting rid of.
Right.
Now, for some toxins, that actually is really good. Like, for example, arsenic, urinary arsenic is a great measure of what's going on in the body. Whereas you want to know what's going on with lead, it has to be a blood sample.
Mm.
And so just
Carter,
a missing
A
element.
blood sample. Yeah, back up. A blood sample is better for lead, but urinary lead is still useful. Urinary arsenic is worthless.
Okay.
but Carter, to your point, like
I'm sorry.
most
I'm
of
sorry.
the
I
tests-
said wrong. I'm on collected.
Yep.
Blood arsenic is worthless. Urinary arsenic is extremely helpful.
Okay.
Blood lead's best, but urinary blood is pretty good. It's pretty good. Urinary
They're like
lead.
opposite. Yeah.
Okay.
Well,
Sorry. My make sure accurate information.
Well, from a systemic perspective, I think the challenge here is accessibility and sort of standardization, approachability, and just being able to do it. Like what I found with all this is it's very, very challenging to do this without a provider. So, and finding a provider, right? So most of these companies, and I think Mosaic's like this, at least from what I've seen in the past, is I cannot, without a doctor, go out and get a test to Mosaic. I cannot, that there are very few labs that allow me, once, if I say I want to become educated about this, about
And there's
myself,
some
I've read
states
the
that
books.
prohibit it, Ellen. There's some states where it's
Correct.
against the law to do that.
Correct. So when we talk about systemic, how we fix the system, what's broken, how do we put the pieces together?
Yep.
This is one of those examples where we have a challenge with our health. And as a person, it is extraordinary. Like we need to we need to remove those barriers to be able to, sorry, I'm tapping my microphone today, to own that health and find that pathway. I mean, I have found some, I think it's real-time labs, right? They're reasonable. They're not bad. They're not great, but they're reasonable. And you can actually order in a number of states real-time labs for urine tests. There are also ways to do lab and have a draw. But to Carter, to your point, it's not easy.
Yeah, so in constructing the sort of roadmap here, the ag people are trying to figure this out in regenerative. The CPGs are getting sort of beat up with GLP-1s and trying to figure out if they can put more fiber in the food or do other things to get in the right direction. I think from a care provider, we have between lifestyle medicine and sort of value-based care, we've got people sort of rethinking like, wait a second, should I be redirecting myself? And then we have people like Ellen, who's N of one early adopter, that we're trying to expand here a little bit by providing them more direct care. We've all done function. We're all sort of fiddling down this path, but we have a lot of people in the audience who are themselves scurrying around to try to do that. And Dr. Joe, I'll jump over a little bit in the lane of the software you've put together that I've personally used, where I'll raise this because it's a good instance of I, as an end user, can go in and load in my data and get more granular insight that may be beyond what doctors want me to do, but it gives me more insight to get N of one control of my environment. Do you mind explain what you're trying to do? You put that together. Explain what you're doing with that.
So as I looked at this idea about how do you give people personalized guidance? So while we can tell people kind of the general things, what we naturopathic call the foundations of health. You have to have the foundations of health. You have to eat real food, get exercise, have loving relationships, avoid toxins in general. That's all important. You got to start there. But then you got to go to recognize the uniqueness of each person's biochemistry and their unique needs for nutrients. So, for example, when I was looking at environmental toxins, I started looking at, how do we get rid of environmental toxins? We have enzymes in the liver that do that, called cyclin P450s. Then I started looking at, is there much genetic variation in those enzymes? 1,000-fold variation. Okay. So a person who's from Africa, typically going to be black, dark skin, that enzyme works way better than it does for Caucasians. So when a black person and a white person are exposed to the same amount of a drug or the same amount of a toxin, the black person gets rid of the drug so fast it often doesn't work. And it has a much less toxic susceptibility. The white person can't get rid of the drug fast enough. They get toxic drug reaction, and all the chemicals are detoxified by that enzyme. They have a more toxic reaction. 1,000-fold variation. Then you look at nutrients. And I looked at this. I just happened to look at this for vitamin D, because the guy who was doing this corporate wellness program in Canada was really into vitamin D. So I started looking at Well, how much vitamin D do people have to take to get up to an optimal blood level? It ranged from 600 units a day to 10,000 units a day.
Wow.
Okay.
Wow.
Because of huge variations in how well people absorb vitamin D,
Mm.
how fast the liver detoxifies vitamin D, and how receptive the cells of the person were to vitamin D.
Wow.
Okay, so I'm getting the idea of how big the challenge is. So I think to myself, wow, this is really complex. And all these nutrients, all these toxins, all these genetic variations, and how well people are making their enzyme systems, how is a doctor, no matter how smart they are, going to be able to figure this all out? And I realized, wait a minute, how about artificial intelligence? So I then started looking at how can we use artificial intelligence to help doctors and consumers as well better understand the uniqueness of their biochemistry and what they uniquely need to be healthier in terms of what nutrients I need more of, or wow, these toxins I'm really susceptible to. How do I get rid of them? For example, I'm dealing with a guy right now who, well, and actually, I don't have permission to say it. Okay. Sorry about that.
Dr. Joe, can I just build on that for a second, ask you a question about public health?
Sure.
So, as I mentioned, I worked in cities that had, challenging economic times, and a lot of the healthcare that we would do is through public health, systems, notifications, government officials. I mean, Ellen, what you're talking about, we talk about health, just finding a provider, navigating the healthcare system, but I think about the public health system, which is even more taxed and burdened. And I think about the environmental risk to the population, the toxic risk, as I mentioned earlier, I think is higher in low income populations. How should we be investing in the public health? And are there simple things? I mean, I'm thinking about, all right, if I'm a person and I'm worried about this, are there simple things I can do if I can't get a test or if I can't get a health test through a clinic? Is there something else I can do to understand how my body might be reacting to something? Are there clues that we're being told that we just need to pay attention to?
Great. So let's go start with public health. I'm a great believer in public health, and I actually served for 6 years before I got term limited off the Seattle King County Board of Health. And we actually had the 12th largest population in the country of people we're taking care of. So I'm a great believer in public health. And I was working towards getting the change. I was making progress until I got term limited off. I think we have to look at public health as more than simply contagion control.
Yes.
Now, let's be clear, contagion control is really important. And the main reason why we have increased longevity is because of contagion control, not because of medicine, either conventional or natural. Basically, babies stop dying from infections when they're 1 year old. So your longevity of the population goes up dramatically. Okay, but let's look at public health more broadly. How about public health that says, well, let's work with farmers to increase the nutrient density of their foods, particularly the minerals and trace minerals, which are such a big problem in chemically grown foods. And let's teach them how to decrease the amount of toxins being put into those foods, the pesticides, herbicides, and cadmium from high phosphate fertilizers. And not only that, now let's work with the food conveyors, people who are transporting that food, people who are packaging that food, to say, yes, we have, as you said, we have to have storage of food. Let's do it safely. Let's not put toxins into the food. And it's a hugely problematic. Our food containers put a lot of toxins into the foods. And by the way, we can use plastic containers if they're properly made. So as I was looking at the research on plastic containers, if you use the pure chemicals that they're supposed to be, they're not very toxic. The problem is plastic containers have about 2,000 other chemicals in them. Okay, accidental and intentional, which means they leak stuff into the food. Lots and lots of chemicals into the food. So anyway, so public health. And the reason I really like public health is because we're now making passive change in people's health. So rather than people have to make any personal changes, we're just making sure that all the choices they're making right now are a whole lot healthier.
And then, so that's something we have to, I mean, I think about, Ellen, where we started with being on the Hill this week, these are just other expansions we need to be doing at the government level to be clear about what is the range of concerns and ranges of tools that we need to be deploying and funding as we really look towards a longer term health trajectory for our population.
Well, and I go back to the talking points about this and the data and what it is exactly we're trying to do. And if we're trying to reverse lifestyle disease, and the reason I say that versus reducing it or preventing it is because the dollars are already being spent, and it's a lot simpler for people to understand a reduction in the dollars being spent as a savings than it is to talk about what's being avoided. I know that sounds ridiculous, but it's
No,
the reality, right? And so, but putting a number, like, I think ultimately what we have, I have two questions to throw out there, or comments. Is one, I feel like we need a number. It goes back to your question, Carter, which is like, in the order of priority of, if I said we need to reverse lifestyle disease in somebody, they have cardiometabolic syndrome, how are we going to treat them between food and between medicine and lifestyle change, right? Then that answers the question of, is chemical load equally or more important than nutritional density, right? And just having whole foods versus having ultra processed foods, like that's.
Can I interrupt right there?
Yeah.
You just said something that was really, really important. The reason I want to interrupt is because my thinking has changed. Since I've been thinking about this, I mean, I've done this for a long time. As I've been thinking about this, I've been really impressed with how well the body is able to adapt to missing or inadequate nutrients. It's not perfect, but the body's pretty good at adapting to it, because you think about it, as we evolved as a species, optimal levels of all the nutrients weren't there all the time.
Evolution is pretty smart.
Yeah. So we've developed a bunch of ways to adapt to these things. But these new to nature chemicals, first off, putting heavy metals in the environment that we weren't exposed to as evolved as a species, so we couldn't develop ways to deal with them. Then all these new to nature molecules, many of them were intentionally designed to be difficult to break down by biological systems.
Right.
When we're exposed to those things, we're having a lot of trouble to adapting to them because our system didn't evolve to deal with these things. So I'm now saying that the primary cause, I think we're all aware, we now suffer the highest burden of chronic disease in every age group ever in human history. Primary reason, environmental toxins. Now, I'm going to be clear. I'm not saying kids being sedentary and watch too much TV is a problem. I'm saying this is
okay, but I'm going to go back and say, if we took, I'm going to challenge that a little to say, if we took all of the environmental toxins out of the ultra processed foods, because to Katie's point, we need shelf stable food. Now, I understand Katie's not an advocate of UPFs at all.
No.
But it's a shelf stable, calorically dense, convenient way to eat. You know, as Carter has said, you know, when we're focused on just getting calories, right? And that's all, it's about feeding people. We talk about UPFs. So if we were to take, I would assume that even if we eliminated the toxins out of the UPFs that we produce, right? So 75% of the food on the shelf was still UPFs, but it had no more environmental toxins in it, and we got rid of the plastic, I would push back and say I still think we would see an enormous amount of lifestyle disease, because that food isn't actually food in the definition of food. So I'm saying that because I think it's really important. We're trying to bring, in this podcast, we're trying to bring a voice to how do we fix it.
But
So
if you took the toxins out of it, Ellen, you'd be left with the organic material that is food.
Right. Well, Dr. Joe, wait, what were you said something?
Yeah, I 100% agree with you. So we would go back to the disease burden we were suffering about 30 years ago. It actually would be worse because the processed foods now are actually worse than they were 30 years ago.
Absolutely. So it is we do have to address both the environmental toxins and the actual food that we're consuming.
Absolutely.
So 100%. It is about restoring health to the soil. It is about getting people to eat, teaching people, engaging people, making it possible for people to eat the way they need to eat. But I'm with you. I couldn't be more in on the environmental toxin message. It's entirely missing. But I will tell you, from my perspective, I'm always like, hey, kind of goes back to, if we have to fix something, if we have to start somewhere, right? Where do we start? And if the traction is around getting people to eat the right stuff, I always worry though that if we are giving people, like, that's why I love Aaron's program versus some of the other programs. You give people a box of produce, right, that has the same contents by words as what Fresh RX would have, for example, but it's food that's got a lot of chemicals on it. It's been seconds. It's been sitting for 2 days, right? are you really going to make somebody healthier? But I guess the answer is, or question for you is, do you, if the alternative is that versus a UPF? So if I give somebody a box, this is a question. If I give somebody a box of produce from a farm, maybe it's seconds. Right. So it's been harvested and it's not regeneratively grown. It's not organic. So we know that the loss of nutrition of that produce is going to go really fast, right?
But it
If I
still has
give
water, it
somebody,
still has fiber, it still has
and it's a
stable
question.
minerals.
I will ask Dr. Joe, does that really help versus the average American diet, or is the chemical load? This is actually a debate my husband and I have regularly is, do you eat the salad at Sweetgreen? Well, Sweetgreen is a bad example. Do you eat the salad at wherever, right?
McDonald's.
Versus, right? Versus do you eat whatever because of the environmental toxins that are likely on what you're eating?
Yeah.
Yes, I'm a geek.
Excellent question. I think we have to recognize we're on a continuum. And
Okay.
what I always, as a healthcare professional, I always look at where people are at and see what's the next step they're willing to take. Okay,
Yeah,
so
meet people where they are. We've said
and I
that.
recommend CSAs all the time.
But would you worry that produce had too much chemical in it, that it's better not to give it?
If you have an opportunity to get an organic CSA, farm share,
right? Well, yeah, but
I'd say yes. If you have an opportunity to do a farm share, do that first. Next choice is organic farm share is your best. Next choice is just non-organic. But
that's still better than. Is that still better than giving somebody? I guess that is better than a UPF box of UPF foods, or is it? I don't know. See, that's the question.
I want to take this in a different direction.
All right.
I just want to let you guys know we are at the hour, but if our listeners are willing to give us the time and we all just can't stop because we love Dr. Joe so much, we can go a bit over.
Yeah. So, going back to my, how do you drive change? You get early adopters to do stuff that then influence early majority and move on. So that's what I was taught. And I believe it's epigenetic. So in my mind. So what has happened recently, both as a result of listening to Aaron Martin's perspective on how regenerative drives adoption, our conversations around meet people where they are, which is, to me, the technical term is N of 1, and then running through the demo on Dr. Joe's software, and also looking at the new Strawberry load from OpenAI, I reached this conclusion. We need to invest more in reducing the friction of me as an individual being able to explore on my own what's right for me and to access the tools that open up my ability to do the next best thing. So that would be an example. I sit down with Dr. Joe's software or something similar. I spill my guts to it. The tool has domain knowledge and has a Bayesian network and is able to understand probabilistically what's connected to what. And then I am now exposed to, based on who you are, based on the best research we have available, these are the things that you should consider. And then the next step is, the only way I get there is if I adopt them, and depending on who I am, I'm willing to adopt them in different ways, economically or personally or persuasion-wise. But in many ways, there are 50 roads to Rome here, some better than the other, and we don't have to fight over which is the best. We really want people to make the decision to start moving down one of those roads. And the positive externality of that is, if I start moving down that road and I feel a little bit better, and the other part of that road is closely adjacent. And so as I think about the investments that we're making, whether it's agriculture or regenerative or testing or assays and all these different things, my mindset is really focused around, how do I remove, in an N of 1 world, I am an individual who wants to move, everybody wants to be healthier, I'm in an individual in this situation, what technology, how do I reduce the friction so that I, as an end user, can make the next best step in my environment without anybody else's help or with other people's help? I don't know, but I can move myself down that pathway without getting stuck in the friction of no, you need to get permission, or you need to go get this doctor to
Well,
approve
it's like
it.
a menu, right, Carter? It's like a menu of things you have to present. And in that N of one or meet people where they are, right, Dr. Joe? Someone's got to look at that menu and go, that feels like a leap I can make. That feels like a choice that I can make right now in my situation for where I am, in my income level, with the resource at my disposal, etc. Right?
Based on the day. So just to experience a little bit more here, and this is his concoction, is I loaded up my Quest data, I loaded up my 23andMe and answered a bunch of questions in over an hour, and it gave me the roadmap of where to focus, said what's your percentage score in terms of where you are in health, and then linked down to, well, because you answered this question at the blood level and you have this DNA marker, here is the actual study that basically says
Mm.
you should lean in this direction.
Yep, that's what our software does. Yes.
Which is awesome.
And I feel like so over the last couple of weeks, my brain has gotten stuck on the fact is what am I doing wrong as an investor around shaping this, and how do we take what Dr. Joe's doing and make it easier for people to access, and it should have a plug into Function Health in it, and that we should expand this early adopter N of one market, because if a bunch of people in that crowd get larger, it will then change the way the CPGs think about problems. It'll change the way that farmers think about problems. And so that, I don't know how to solve it yet, but that's where my brain is. That feels like an easier way to solve this problem than persuading, I don't know, all the other choices. We're going to the hill and having a conversation.
Oh no, I'm with you.
Oh, wait, let's
Carter.
let Dr. Joe respond to that.
So I can't tell you how happy I am that we're having this conversation and people of your competence are looking at this. So let's go way back to 1978 when I decided to start what was then named John Baister College of Naturopathic Medicine. My primary driving factor was here I was seeing these patients, I give them all these health messages, and I see them again a month later, and they get 1,000 ill health messages. And I realized in order to improve the health of my patients, I not only had to work with them directly, I actually had to work with the environment in which they were involved. When I was in naturopathic medical school in 1971, naturopaths were licensed in 6 states, and we were a felony in 2 states. Okay, that just shows you
Wow.
how anti this idea of healthy living and healthy doctors has how hard the MDs have tried to get rid of them, or actually say AMA, not the MDs, AMA. So I said, we need more people who think like this. And the way to do that is by creating more doctors. By creating more doctors, they'll go out there and help people, they'll write books, they're going to give lectures, and we're going to start to see a change. You look at the world today compared to where it was 50 years ago when I started the school, and almost 50 years ago when I started, I'm sorry, a little over 40 years ago when I started the school, it's been dramatic. So my belief is that as these messages get out there, as more and more people hear about it, you look at, RFK Jr., talk about MAHA, Make America Healthy Again. Now, I don't care about your politics, whether it's Democrat or Republican. The very fact we got somebody on the national stage having those kind of conversations, a guy who visited me while I was at Bastille to talk about health, see, that tells me we're going in the right direction.
Yeah.
And so the more we are doing this, the more we're going in the right direction.
Yeah.
I agree. And I agree, Carter, with what you're saying, I guess. And I actually doubly agree. And I said this morning when we were chatting. I don't think this gets driven from policy. I think we have to spend time on the Hill to educate so that people understand, like the Farm Bill, like places that are financing our food system that do have to be part of this, the things that are financing the healthcare system, right? Those that are making decisions around how those things are built, they are huge drivers of a system we're trying to redesign. And so I think it's important to come at it from both ends. So one, an N of one tool for early adopters for those that can do it. But I think also educating those that are building the financial and economic components that will eventually finance these things or do finance these things. It's imperative to come at it from both angles. And so I do think there's a massive lack of education on the food side around chemical load. There's this, well, everybody can't afford organic, right? It's like, Yeah, we're not talking about trying to be like organic for the whole food set and the haves and the have nots. Like, we're talking about base health. And if you can't get to health with the chemical burden that our food system is creating, then we're doomed. That's why I get all fired up about it, because I think that is it. I'm Ellen Brown. I'm not going to solve that by any means, but any way that I'm trying to push the food is health and food is medicine agenda, even from a value-based care perspective, it has to include that messaging around the chemical burden and the nutritional load of it, like all those components.
Totally. But Ellen, this means it also has to be interdisciplinary. I mean, this can't just be people in the food space. It has to be people
Yes.
in other businesses. So it's got to be, for instance, why does every mattress and sofa have to have flame retardant on it?
Absolutely. I got
So
my 8
these
sleep
are like,
last night, Katie, and I think I probably need to go sit in the sauna for a week. Like, seriously, it's in my room off gassing.
So this is a holistic approach to so many exposure pathways. And I think what we have to be talking about, and what I always talked about when I was doing environmental planning, is a person clearly understanding all of their exposure pathways and how do we mitigate for each of them and in different ways. And there has to be situational awareness across that. And for myself in economic development, I had to understand what economy was I building in a community, and how was it either exacerbating or eliminating exposure pathways? We don't talk about that. Land use and zoning was created to protect the health, safety, and welfare of people, so you weren't living next to polluting uses. But we've stopped talking about that. And like we've assumed it's gone away. It hasn't gone away. The EPA will tell you it hasn't gone away.
Well, I would say we actually have a even more complex problem there, in that there were a bunch of people who were doing breakthrough work that led to those conclusions. It then ended in policy, and then we show up with policy people who don't really know why it showed up, but are focused on the policy. And now we're focused into some of these debates about NIMBY, YIMBY, and you don't want to change. And
that's right.
And so we're going to go through a weird backlash. There was a conversation about, it's a little bit odd, but it was like, we're going to change politics in the future, that you don't have to have a college degree to show up and to work in the government. But I look back, and in 1880, they put rules in about education because they didn't have them, and there was a whole bunch of giving away jobs to whoever was your favorite. And so we put these rules in place for reasons, and then forget why we put rules in place. I still go back to that. If I look at
a complicated issue,
yeah, and there are
that's people, a workforce development issue that's very complicated, Carter.
There are doctors who are trained to follow particular procedures because that was a good decision, who really don't know why those procedures were explained. Now, when we go back to what has come out in the strawberry version of OpenAI, it is more prescriptive in this particular way. When we look at, that's a different way to do the AI. When the way Dr. Joe's taken it is a bit more down a Bayesian path. I don't mean to go here, but when I look at the tool sets that are becoming available in tech, we are now down to a point where at an N of one area that you can take, I think we're very close to a point where the information, the technology makes the information available to a level of understanding that somebody who has a casual inference of an understanding plus can take their blood test data and can take some of their other fact-based data and infuse it and end up getting a more customized viewpoint of what's right for them on an N of one basis, better than a whole tribe of advisors. And so the entire shape of how we deliver this information, I think, is as I look across all of our portfolio companies and I look at how the technology is speeding up, we may be at a break point. And when we see that CGMs are now OTC, when people are
use glucose monitors over the counter, I'm just interpreting for people who might not know the shorthand.
I think we're at this kind of tipping point that's not unlike when a whole bunch of us were downloading FTP copies of Netscape and installing it on our PC in 1992, where we're moving to the point that it will become easier,
Normalized.
and it is really super exciting. I am
Normalized, but cost competitive, Carter. It's got to be, the accessibility again.
cost will come down dramatically. I am, so I'm ready to go.
It's got to happen because knowledge is power. And the only way that the consumer is really going to drive this is if they have the knowledge that creates the power. But if we withhold the knowledge and we withhold the power because we don't have accessibility to the tools, we're never going to create change. And so I'm inspired, Carter, by what you're saying. I hope that's true. Dr. Joe, I love that you've created something that's accessible. I can't wait to try it out myself. But
Great.
the point being, we have to normalize this. We have to bring this into public health realms. We have to make this easier to access. Through that, I've never met anyone who had the knowledge who didn't then say, I need to figure out the power to change this, right? But if you don't have the knowledge, then you only know what you know, right? And we have to increase what people know. I love that.
I like to riff on that a little bit. One of the things the AMA did about 100 years ago is they moved people away from taking care of themselves and using local healers, the local wise woman. That local wise woman who provided a lot of healthcare 100 years ago and before was now old wives' tales. Okay. And they taught people they had to depend upon the authority of the doctor for their health. And people were systematically removed from the connection between their actions and their ill health because they're given drugs to turn off the symptoms of the mistakes they were making.
Right.
Okay. So we have, when I look at I've done a lot right. I've written 4 pillars of health. Number 1, public health. Way more attention to public health. All things we talked about, not just contagion control, but all these other, all the nutrition and toxins and such. Number 2, primary care. That's very different. Primary care looks more like what a naturopathic doctor does, and that is, yes, we'll diagnose your disease, but more importantly, we're going to diagnose your health. How are you living your life? How can we make your life better? How can we have less disease? So the disease brought you in. Now let's teach you how to be healthy. Third one is what the MDs do now, where things progress beyond what the body can take care of itself. We need a high-tech intervention. Great, we need that. Let's have it available. And the fourth part, my first editorial didn't write about this. Fourth part is engaging the user, the consumer, the patient, and get them out of this passive mode and into an active mode of taking care of themselves.
Yeah, 100%. I love that. So you guys, with that, I mean, I think this was such a cool conversation. Oh my gosh. Dr. Joe, I'm so grateful, for this. And I just want to let Ellen and Carter give sort of because that was a great summary thought on your report. Ellen, quick summary thought to tie a bow on this, and then I'll hand it to Carter.
I would just go back to, oh no, Katie, you go. I mean, Carter, you go. You sound like you're ready.
We're not even organized at this point. So I'm just fixated on the N of 1. I want to build on what Dr. Joe's got. We got to think about trying to figure out how to build that at this point, and it's across about 5 or 6 of our portfolio companies, and that's I'm struggling with and need help.
But there's other people doing it too, and it's not just your portfolio companies. There's a whole bunch of them. I think sometimes that's the tough part for me, Carter, is feeling like I have my arms around. I mean, I just met with.
I'll add others to it, but
I just met with folks in Switzerland this morning. Like, there's people doing it there.
I want to build the thing.
Yeah,
I'm a builder at that point.
Yeah, the tent's got to be open. Yeah, Ellen, go ahead. Your bow.
I just want to. I want to make sure we don't leave behind, to your point, Katie, a whole bunch of people.
Yeah. And
we have a big bridge to build here, even with early adoption and all of that. And when you look at where the disease burden is and where the cost burden is,
yep,
a lot of it is disproportionately on the side that are not going to be part of the early adopters.
Right.
So I'm 100% in that we need an N of 1 solution and all the things that we're talking about. But I guess I just really want to see us coming at this from both angles of trying to address some of the root causes within the system that we've created,
Yep.
both within the healthcare system, within the food system, within the grocery, CPGs, all that. But at the same time, creating an N of one for people to be able to own and understand their health. I've talked to Carter, just like you. I want to see that tool. And I've talked to a bunch of people that are building different variations on it. And I'm super excited about that. But I also don't want to leave the other stuff out. But don't worry, I'm not going to become a policy and Hill devotee after my couple of days this week.
All right. With that, we are going to end it there. Dr. Joseph Pizzorno, thank you so much for joining us today on the Health Revolution podcast. Everybody, go get the book, The Toxin Solution. It's just such a great roadmap for what we're talking about today, and I think it would be informative for everyone. As always, Ellen and Carter, thank you so much for your time. It's Friday, so have a great weekend, and I look forward to seeing you all next time we meet. Thank you.